The helpguide.org second suicide prevention tip is to respond quickly in a crisis. If a friend or family member tells you that he or she is thinking about death or suicide, it's important to evaluate the immediate danger the person is in. Those at the highest risk for committing suicide in the near future have a specific suicide plan, the means to carry it out, a time set for doing it, and an intention to do it. The following questions will help you assess the immediate risk for suicide. Do you have a suicide plan? Plan. Do you have access to what you need to carry out your plan? Guns, pills, etc. Means. Do you know when you would do it? Time set. Do you intend to commit suicide? Intention. There are several levels of suicide risk. Low. Some suicidal thoughts. No suicide plan. Says he or she won't commit suicide. Moderate. Suicidal thoughts. Vague plan that isn't very lethal. Says he or she won't commit suicide. High. Suicidal thoughts. Specific plan is highly lethal. Says he or she won't commit suicide. Severe. Suicidal thoughts. Specific plan is highly lethal. Says he or she will commit suicide. The next thing I say is possibly the most important thing I have ever said in the history of bipolar opposites. If a suicide attempt seems imminent, call a local crisis center, dial 911, or take the person to an emergency room. Remove guns, drugs, knives, and other potentially lethal objects from the vicinity, but do not, under any circumstances, leave a suicidal person alone. Their third suicide prevention tip is offer help and support. If a friend or family member is suicidal, the best way to help is by offering an empathetic, listening ear. Let your loved one know that he or she is not alone and that you care. Don't take responsibility, however, for making your loved one well. You can offer support, but you can't get better for a suicidal person. He or she has to make a personal commitment to recovery. And it takes a lot of courage to help someone who is suicidal. Witnessing a loved one dealing with thoughts about ending his or her life can stir up many different emotions. As you're helping a suicidal person, don't forget to take care of yourself. Find someone you trust, a friend, family member, clergyman, or counselor, to talk about your feelings and get support of your own. To help a suicidal person, get professional help, follow up on treatment, be proactive, encourage positive lifestyle changes, make a safety plan, remove potential means of suicide, continue your support over the long haul. Risk factors for suicide include mental illness, alcoholism or drug use, previous suicide attempts, family history of suicide, terminal illness or chronic pain, recent loss or stressful life event, social isolation or abuse. Next, we will review the growing risk factors for suicide, as both teenagers and older adults are at a higher risk of suicide. Risk factors for teenage suicide include childhood abuse, recent traumatic events, lack of a support network, availability of a gun, hostile social or school environment, exposure to other teen suicides. Additional warning signs that a teen may be considering suicide include changing in eating and sleeping habits, withdrawal from friends, family, and regular activities, violent or rebellious behavior and running away, drug and alcohol use, unusual neglect of personal appearance, persistent boredom, difficulty concentrating, or decline in the quality of schoolwork. Frequent complaints about physical symptoms, often related to emotions such as stomach aches, headaches, fatigue, etc. Not tolerating praise or rewards. Risk factors for suicide in the elderly include recent death of a loved one, physical illness, disability, or pain, isolation and loneliness, major life changes such as retirement, loss of independence, loss of sense of purpose. Additional warning signs that an elderly person may be contemplating suicide. Read material about death and suicide. Disruption of sleep patterns. Increased alcohol or prescription drugs. Failure to take care of self or follow medical orders. Stockpiling medications. sudden interest in firearms, social withdrawal, or elaborate goodbyes, rush to complete or revise a will. I gave great thanks to Help Guide for this wonderful assessment on suicide prevention. I gave most of the content from this site in this video, but I want to give you the website if you wish to do more searches at the site. www.helpguide.mental/suicide_prevention.htm has a great vast of other information, and I highly recommend you visit the site so you can learn the facts and prepare you for such situations, as you never know when you'll need to save a life.